I know that most of you have just as many questions as I have, so I brought in my buddies from Marreel Slater Insurance, John and Cari, to tell us more about what's going on here. So we're going to break it down in verbiage that everybody can understand, right, John? That's what we're going to do, huh? Okay. How you doing, John? Okay?
I'm doing good. Yeah, good to see you.
Good to see you, too. Cari, how are you?
I'm fantastic.
Rookie question right out of the gate. Tomorrow's October 1st. What does that mean?
Yeah, great question, Dave. So there's a lot of noise going on with health insurance right now. Every day you're reading the paper, there's new articles. Politicians are fighting over it. Everybody's got an opinion on it. Really, for the people out in the public right now, there's three main things that are going on. October 1st, the reason why that date is important is that is the first day of what we call open enrollment on the new healthcare exchanges. And that's a terminology you're going to start hearing more and more in our industry, that people can buy health insurance through these health insurance exchanges. It's mainly for buying individual healthcare coverage. So if you're covered by your company, you're going to keep things most likely the way they have been. You'll still get health insurance through your company. It's really geared more for people that don't have health insurance right now.
For individuals.
That's right, that need to buy health insurance.
And the exchange is for the lower income?
That's right. Exchanges are just a method to buy health insurance where you can qualify for a subsidy at certain income levels. So for us, for our agency, starting tomorrow, when people call our office and they want to buy an individual policy, the first question we're going to ask them is, what income level are they at? Because if they're at certain income levels, we will place their individual business through the health insurance exchange. And that way they'll get a portion of that covered by the federal government.
And Cari, income levels, what income level and below qualifies for the exchanges?
So if it's a family of four, for example, if you have an income level of $92,000, around $92,400, you could qualify for a subsidy. If you're a single person, it would be around $45,960.
So family 92.
Mm-hmm.
Okay.
Now, they won't get their entire subsidy. They won't get the entire cost of the insurance paid. If you're at the upper end of that income levels, you'll get less of a subsidy. Mm-hmm. But that's really what people are going to be looking at.
So, John, they enroll for the exchange program,
mm-hmm.
which gives a subsidy.
Right.
But that doesn't actually go into effect until January 1st,
That's
correct?
Right. All of this takes place. It goes effective January 1st of 2014. Part of the controversy around all this is that individuals are required to buy health insurance starting January 1st of 2014. Otherwise, if they don't buy it, they will be faced with having to pay a penalty. So this is what they called the individual mandate that you've heard about on
It's
on the
mandatory
news all the time.
insurance. You have to
buy
it.
insurance. So if you don't have insurance right now, you have to buy it. The exchange, as I mentioned earlier, is one method for people to buy health insurance to get part of it subsidized. We will still be selling individual policies outside of the exchange for people that don't qualify for subsidy.
All right. Now, for those of you who, are having a hard time wrapping the brain around this, as great of a job as John and Cari are doing breaking this down for us, we're going to make it even easier. You can just call Marreel Slater. In fact, Cari, you usually answer the phone, don't you?
I almost always answer the phone.
You'll personally take care of them. You can go to websites and you can try to browse around, and that's fine. You can try to educate yourself, but it's just so much easier. I'm going to put some work on your plate, Cari. It's just so much easier to call because every individual is different. Income levels are different. Every person's unique, and Marreel Slater takes care of you as individuals as well as companies, and we'll get into that. As far as enrollment, it's important for people who are currently sick, wanting medical help, to understand that this is an enrollment period, and they probably still can't get the help that they need till January 1st. Is that correct?
Yeah, let me elaborate on that a little bit, because the number one question that we're getting in our office is somebody that calls in that has what we call a pre-existing condition. So maybe they have an unfortunate medical condition that they're dealing with, and they haven't been able to buy health insurance because under the insurance companies would have declined them for those medical conditions. That goes away starting January 1st as well. So somebody that has a medical condition that has not been able to get individual health insurance will now be able to get that individual health insurance. So insurance companies are not allowed to decline anybody because of health conditions. So,
and John, what about the rates on that? They have to be really high, right?
Well, the rates,
sick.
and this is the controversial part. We're opening up access for people where more people will be able to buy health insurance. But the impact is what's going to happen to the rates. The rates are just starting to get published right now. So we've seen a little bit of it. Some of the major companies that we work with, all the major insurance companies, but like Blue Cross Blue Shield, we do a lot of work with them. They released their rates here just recently. So we can kind of see what the rates look like based on the age of an individual. And it's going to be based on age and demographics, where you live, what your zip code is. And then you can ask what your family composition is. So if you're buying health insurance for just yourself, or yourself and your child, yourself and your wife, yourself and your spouse. So that's how the rates will be determined, and they're not allowed to ask any medical conditions at all for policies that start January 1st.
Now, with Blue Cross Blue Shield, Marreel, Slater, you are qualified brokers for Blue Cross Blue Shield.
Yeah, we're an authorized broker.
With
Blue Cross Blue Shield and many others.
The thing about it now also is that beforehand, when insurance companies were able to do medical underwriting, we would kind of have to go back and forth, and we didn't know exactly what the rates were going to be because they could increase the premiums based on medical conditions. And now there's only those 4 things that John had mentioned that insurance companies can rate on. So immediately when somebody calls in, I'll pretty much know what the rates are going to be and can tell them exactly what they're going to be. It's not like it's going to be an estimate and then, a couple of weeks later their premium could increase by $300. We'll know exactly what the rates are going to be at the time that somebody calls.
John, you mentioned that individuals, they have decisions to make at this time in the enrollment period. They'll be shopping for rates, and they need to take care of it by January 1st, so there's a penalty that comes in place. You also mentioned that those insured by some of the larger companies, they might just want to keep their current insurance, and they're set to go. But let's talk about smaller companies, and I ask that because of our double-wide network. We're a small Arizona family-based company, and I know that we have a lot of listeners that also have smaller companies. Tell me about how this will affect the smaller companies.
Yeah, for smaller companies, it's going to, the way we see it changing is we do a lot of work with small businesses. So we put what we call group plans together for the employees in small businesses. We do a lot of that right now. What's probably going to change for those is that we're going to still look at the group plan. Their rates may be more affordable to continue a group plan. But in some cases, we'll also look at a small group and see whether it makes sense to put them on individual policies instead of a group policy. So for the individual market, we're going to really be looking at it in both avenues to see what makes the most sense for the group. Obviously, this stuff is expensive, so we're looking to come up with the most affordable pricing and best benefits that we can offer to a small employer group so they can continue to offer those kind of programs to their employees.
So with a small employer group of 4 or 5 people, individual might still be the way to go. They might be able to get better rates.
It could, and that's a big part of what we're going to be doing is evaluating does it make sense to stay on a group plan or look at possible individual coverage as well.
We should mention, too, that Marreel Slater is Arizona-based and an Arizona family-owned and operated company,
That's
I
right.
might add.
Yep.
Tell me about the little help thing on your website. That's cool. I think it's going to help a lot of people.
So on our website, there's just it's a help button, basically.
A little finger with a help sign on it.
If you go on there, it's basically on the main screen. You just click the little help button, and that's what we're here for. We're here to help you figure out what the best route is for you, for your individuals, for your families, for your businesses. And we'll basically take all the work off of your hands and figure out if you qualify for the subsidies and which plans that'll work and protect you and your family best.
See?
That's right.
That's why I got you here, Cari. Kind of clear all this stuff up. Is there anything else that you want our listeners to know at this point? Obviously, if they have any questions, they can call your office. Is there anything else that you want them to know at this point?
No, I guess the only thing I would mention is that there's so much media going on right now about health insurance, and we just try to take it down to the individual level. How does it impact you as a person? And that's the service that we want to provide to everybody, is just what's the best thing we can put together for you and your family. And that's a service we'd like to provide.
All right. And Cari, you'll be talking to them when they call.
I will, absolutely.
All right. Let's give the phone number, 602-476-0057. It's Marreel Slater Insurance, 602-476-0057. And big kudos to Blue Cross Blue Shield, too, because you are authorized brokers for Blue Cross Blue Shield, and I know they do a great job getting rates and taking care of people. So Blue Cross Blue Shield, we appreciate you. We love you. Thank you so much. Marreel Slater Insurance, 602-476-0057. I'll throw out the website for you now, too. It's msinsuranceLLC.com. And again, you guys are used to contacting me all the time. I'll be glad to throw these back at you, whether it's the phone number or website, and we'll make it easy for you. Thanks a lot for coming in, guys.